for heaven's sake. It's your children's lives and their future. Not yours, but theirs. Don't let what happened to me and my wife happen to your children.
In fact, there have been some massive disasters around the world following vaccination programs.
Babies are injected with bits of animal, bacterial, viral DNA. They can be incorporated into the human genome. A human DNA structure is changed, or can be changed.
And we are seeing increasing incidence of behavioural abnormalities. We're seeing increasing sociopathic behaviour, increasing crime rates, increasing learning difficulties, attention deficit behaviour. There certainly are some who theorise that that is due to low-grade encephalopathy caused by the vaccine.
Almost 3 years of research before we looked at each other with my late husband and said, vaccines are killing babies.
So it was obvious that I, and every other doctor for that matter, had been grossly misled.
The doctor politely calmed us that it was all right and it was a good thing to do. We did it. We gave him the DPT vaccine and another one as well. We drove from the hospital down about 10 minutes after we'd left the hospital. We were heading home to our farm. And Dylan suddenly started to convulse in my wife's arms in the car. This was just a shock. We were totally lost for that brief moment. We didn't know how or what was going on. Dylan started to turn blue. I just felt so helpless.
Hello, I'm Bronwyn Hancock. For many, an experience like what we just heard from parent Shane Tucker is the first clue that something may be wrong with vaccination. Even then, doctors tell many parents, including him and his wife, that there is no link, so more vaccines are given. Why? Because doctors are taught that damage occurs in only 1 in a million, and far many more lives are saved. Yet despite what they are taught, and many probably believe, many surveys have found that doctors are in fact the least vaccinated in the community. In this look at vaccination, we're going to find out the truth for ourselves. What vaccination does not do, what it does do, why it continues, what our rights are, what can in many cases help counter the effects, and what is the true key to immunity. So to start with, let's have a look to see if vaccination really can be shown to have saved lives. Dr. Isaac Golden is a prominent and experienced homeopath, teacher and author of several books, including one on vaccination. Let's hear what he, along with many others in fact, have found out.
Before I knew what natural medicine was, I used to vaccinate my own children, and one of them, my eldest daughter, was quite severely damaged. And that led me to question whether or not what I was being told by doctors was really accurate, because I was told time and again to go back and keep vaccinating her despite the reactions that she was having. Eventually, the penny dropped and I realised that there was a direct cause between the symptoms that she was experiencing, going from a completely healthy young child to someone who wasn't, and vaccines, because the symptoms were intensifying after each vaccine. That led me to really start looking further than what I was just told by doctors. And where I started was basically with the health departments in England, America and Australia, because my original professional training is in economics and statistics. So I wrote to the governments and got figures. And then I realised when I started plotting the figures on charts that in fact there was a lot of information that we were being told by the orthodox medical profession which wasn't true. And it also made me realise that a great deal of information given to medical students was probably very misleading. Let me give you an example on the overhead. We have here the figures of deaths from whooping cough in America from the time that vaccinations were introduced to around about the late 1980s. These were the figures that I got from the American government themselves. And what they show when you look at those figures is quite clearly, apparently, that the introduction of vaccination caused a great fall in the deaths from whooping cough. However, What I also got were the figures for 40 years before vaccines were introduced. And you can actually see where the arrow is, where vaccination was introduced. And so it is quite clear that the majority of the reductions in deaths from whooping cough occurred well before vaccination was even introduced. So the claim in this particular case that vaccination was responsible for eliminating most of the deaths from whooping cough in America is clearly statistically false.
The pattern with whooping cough is, of course, not unique to that disease, as Dr. Vera Scheibner will show us. She is a retired principal research scientist who by now has studied well over 60,000 pages of orthodox medical research articles on the subject, also culminating in a book.
It is a well-documented fact that the incidence and mortality from infectious diseases like measles, whooping cough, rubella, mumps fell by 90% before any vaccine has even been introduced. The mortality from diphtheria between 1900 and 1960, you can see that there was a steady downward trend in mortality from diphtheria long before any treatment has been introduced. And topsoil is vaccine. And you can see that even after the introduction of the treatment and the vaccine, the downward trend simply continued. This is death rate from measles between 1900 and 1960. Again, you can see steady downward trend in mortality from measles without any vaccine. There comes the vaccine here, and it was already at the tail end of mortality from measles. So there must have been other factors than vaccines that caused the observed fall in the mortality from infectious diseases.
Also, as you can see from these graphs, the introduction of the vaccine was not followed by any acceleration in the decline. And, sure enough, an analysis of figures for outbreaks since does not show the vaccinated to be any more protected than the unvaccinated. For example, in an epidemic of whooping cough in Sweden in the late 70s, 84% of the population were vaccinated, and yet the percentage of cases known to be vaccinated was at least 84%. So, as an explanation, vaccinators speak of a principle of herd immunity. Their definition of this term, which is quite different from what it originally meant, is that at least 95% of the population must be vaccinated to prevent an outbreak. But does this work in practice? To find out, we need only look at the United States, where vaccination is compulsory for school entry. Dr. Scheibner will describe a situation which actually occurs very often soon after a vaccination program. In this case, it was in Corpus Christi, Texas, where they had just ensured that 99% were vaccinated, of whom 95% developed antibodies.
An outbreak of measles occurred among adolescents in Corpus Christi, Texas, in the spring of 1985, even though vaccination requirements for school attendance had been thoroughly enforced. And of course, this is not some sort of a rare occurrence. Epidemics in fully vaccinated populations are a rule rather than an exception.
But many doctors say that we must have had great success with the HIB vaccine, because HIB has dropped since it was introduced a few years ago. Well, let's have a look at a breakdown by age relating to its phased introduction in the United States.
This is the incidence of Haemophilus influenza meningitis in children less than 5 years old. This is between 1980 and 1991. Here you have the incidence of bacterial meningitis in children younger than 1 year. These are 1-year-olds, and these are 2 to 4-year-olds. The fluctuations, and particularly the fall in the incidence of meningitis in children younger than 1 year and in 1-year-olds, had nothing to do with vaccination, because the vaccine was only introduced here, and meaning the vaccine that was licensed for use in these age groups.
Finally, let's have a look at what happened in Hamburg, in Germany, without any intensive active prophylaxis.
And this is pertussis whooping cough in Hamburg between 1956 and 70. You can see a steady fall in the incidence of whooping cough. and this is whooping cough with complications, at the time when the rate of live births increased in a substantial way.
So what did cause the decline? Let's hear from Dr. Robin Cosford, a Sydney medical doctor, and Pauline Rose, an independent nurse practitioner.
Scarlet fever, which is an infective disease caused by the streptococcal bacteria, was in existence and same sort of levels at that same time as whooping cough, measles, polio. And these are the diseases. And we do not vaccinate against scarlet fever. We never have vaccinated against scarlet fever. And interestingly, the incidence of scarlet fever has dropped off, paralleling the drop in whooping cough and polio and so on. So it would appear, when we actually consider these other factors as well, that it's not the vaccines that have reduced the incidence of these diseases, but other things that were going on in society at the time. There were basic public health measures and sanitation measures, and these seem to be the things that have made the major impact.
And some of the studies that have been done indicating that it wasn't the cure-all that everybody thought it would be, and that in fact there have been some massive disasters around the world following vaccination programs. And that measles, for example, was dying out in Europe, and then they started the vaccination program, and it rose again. And that the thing that had cured measles was in fact the better nutrition programs, a simple general pick up in the health of the population, increase in vitamin A levels. And the vaccination wasn't solving these problems at all. Just as many people were getting sick post-vaccination as they were before.
So not only does it appear that vaccines do not work, but there is evidence that they are in fact counterproductive. Back to the United States.
This is the incidence of whooping cough, morbidity and mortality from whooping cough, deaths from whooping cough between 1922 and 1987. You can see a steady downward trend in both morbidity and mortality until about 1978. I wrote this down here myself. Because after 1978, you can see this very unnatural, sharp upswing in the incidence of whooping cough, and mortality remained stationary.
So what happened in 1978?
In 1978, a nationwide childhood immunization initiative was begun. Individual states passed legislation requiring proof of immunization for school entry at 5 and 6 years of age. They mandated vaccination, and it resulted in a threefold increase in the reported incidence of whooping cough. And indeed, children develop whooping cough from the vaccine. And when I say that, of course, vaccinators are up in arms, saying that a child cannot contract whooping cough from the vaccine. But of course, because Bordetella pertussis is dead in the vaccine. But whooping cough is a toxin-mediated disease, meaning it doesn't matter whether Bordetella in the vaccine is live or dead, or whether it is there at all. Because the acellular whooping cough vaccine doesn't contain whole cell Bordetella pertussis. It only contains the protein envelopes. And children can still develop whooping cough from that vaccine.
After 20 years of immunization in 1989, the mortality per 1,000 people in Europe was 10 times less than it was in America. So the Swiss, in spite of having no immunization policy, had 10 times less mortality from measles than did the United States, which by that stage had a 20 years of vaccination experience and had mandated it.
The most interesting thing about the situation in the United States is that the Amish, it's a religious group who reject vaccination on religious grounds. The Amish didn't report a single case of measles between 1970 and 1988. For 18 years, the unvaccinated Amish did not report a single case of measles.
But what about smallpox? Hasn't it been eradicated? Well, vaccination seemed, with this too, to only slow the decline which had already been occurring. Dr. Archie Kalakarinos is a medical doctor and author well known for his success with vitamin C in his work with Aboriginal children.
There's a big epidemic of smallpox in the Philippines, and this was a very important epidemic in many ways because statistics were kept for the first time. And it was clearly demonstrated that the only people who got smallpox twice were the vaccinated, and that there are far more cases of smallpox amongst the vaccinated than amongst the non-vaccinated. And these statistics are available if people want to see them. Now, I think these are the most glaring examples of how people are being misled.
Smallpox outbreaks are, in fact, still occurring in Africa, Asia and India, where there is conflict and poor nutrition. So, how do researchers get figures which appear to show that vaccines have been successful? Well, there are many ways. One is through misleadingly strict definitions of vaccinated. Another is how the disease is diagnosed.
I have always been looking for articles that could demonstrate that vaccines work. And when I saw this title, The Elimination of Indigenous Measles, Mumps and Rubella from Finland by a 12-year, 2-dose vaccination program, I said, wow, this is it. This is the article that I've been looking for. So let's have a look how they eliminated indigenous measles, mumps and rubella from Finland. Results. The 99% decrease in the incidence of the three diseases was accompanied by an increasing rate of false positive clinical diagnosis. Another little book. So these children, Finnish children were still developing measles, mumps, rubella, but they called it false positives. What is a false positive?
Polio is a striking example of what you can achieve when you change the diagnostic criteria, as New Zealand medical doctor David Ritchie will reveal.
In 1954, the Americans pushed forward a polio campaign with the oral Sabin polio vaccine. What happened within the first year was, to their horror, they found that particularly one type of the polio vaccine was causing polio. Because what, of course, the vaccine is not a totally killed virus. You're giving polio in a partly killed form, so-called attenuated form. And so they jumped up and down and got rid of this particular type of polio vaccine. That was fine. Then they realized to their horror, this is written up, this is actually reported by Dr. Ratner, who was a public health official in Chicago at the time. The next thing was they realized that in fact all the different types of oral polio vaccine would cause polio. That also was a bit of a shock. And so they simply ignored that data. That data has never been released really that publicly. You'll find it very hard to find that in the published literature. What they did though was they decided to redefine polio. Prior to that, polio was by definition, if you had muscle weakness in one limb, one or more limbs, within 2 examinations, 24, 48 hours apart, it was called polio. What they did, the first thing they did was say, okay, polio can only be diagnosed as polio if the person has still got paralysis 60 days later after the actual event. Now, most cases of polio, of course, the paralysis resolves within the first few days. Very few go on to get permanent paralysis, although, of course, that's the form we see most dramatically. That's more than, I think that cut the polio in the Western world by about 80%, just by changing definition, not by vaccination. They then went a bit further and said, look, there's all sorts of other viruses that can cause a polio-like syndrome. We better make sure they're not included. So they changed the definition again. And they said, okay, polio is now only diagnosable if you can grow the polio virus from the feces and you haven't been immunised in the last month, because of course we excrete the polio virus after immunisation. So by these two rather interesting changes of definition, the rate of polio, the incidence of polio, dropped dramatically in the 1960s.
And now I will show you how they eliminated poliomyelitis in the Americas, meaning South America. In these countries, there are less than 100 reported cases of polio per year. They started vaccinating in 1985. Within 4 months, they had an outbreak of 350 cases. Indeed, these shadowy columns here are reported, notified cases of flaccid paralysis. And these black columns represent confirmed cases. They couldn't do very much about it here or here, but they started fiddling with the figures. So they caused a sustained, huge outbreak of poliomyelitis, but they started discarding most of the cases. That's the word they used in the paper, discarding.